Good afternoon again. Our third lecture in this room is going to be from Jess Clifford, who we know a long time, and he's going to lecture on BisPhenol-A and Biocompatibility. He's a researcher, lecturer, and a former college instructor, founder and president and research director of Clifford Consulting and Research in Colorado Springs, IAOMT fellow and a past president. Let's give a good, great welcome to Jess. Thank you.
Today, we want to look at the nasty subject of BisPhenol-A. The stuff that they assured us on television last week is going to kill every one of our children before the sun goes down. And your patients called immediately in horror. Do you remember the occasion? Today, we'd like to talk about BisPhenol-A and material safety. Full disclosure, please. Clifford Consulting and Research. Testing is provided from Clifford Consulting and Research. I should say Clifford Materials Reactivity Testing. The presenter is the inventor and developer of the CMRT regimen and has a financial interest in testing and owns CCR. BisPhenol-A. Presenter does not have any interest in the manufacture, sale, or use of BisPhenol-A. We do test for sensitivity to it. IAOMT does not have any interest in CMRT sales or promotion, in CCR, or in BisPhenol-A promotion or sales. Thank you. What is this stuff called BisPhenol-A? You should have just received a handout that has some 16 forms of bisphenol compounds. And sometimes it's interesting to show this to a patient and say, which bisphenol are you concerned about? Because nearly, not all, but nearly all of them on that page that we just shared are in your materials. In one place or another, they are there. These properties and qualities have to do with the material itself. And you will note that it is easily synthesized by simply taking a condensation of acetone and two equivalents of phenol. This is the chemical structure of the material, and this is a block of what the material might look like in 3 dimensions. It really doesn't look that dangerous, does it? If I took 2 of the phenols and the one on top, which is the acetone, and put them through a synthesis, this is the bisphenol-A compound. The most important part of this molecule happens to be right out here, where the hydroxyl groups are found on either side. From BPA, we can form a number of other compounds. Many of you will recognize this name as being associated with the materials that you use. Bis-dimethacrylate. It is not the same, nor does it operate and act the same as bisphenol-A in the culprit down at the bottom. You'll notice in the culprit at the bottom, right here, is the bisphenol-A. Out to either side is an acrylic molecule. There's an identical one sticking out on this side. If we took one of these, pulled the hydrogen off either end, and stuck it right here or right here, it would form another union just like this. In other words, the role of bisphenol-A in our products is to make a very strong, durable long-chain polymer. That long-chain polymer is not easy to break. And that's why you will find it used in so many of the products. It is the primary basis for a large number of general plastics. It's a key monomer used in a number of epoxy resins. It is the most common form of polycarbonate plastic. Its high strength makes it very desirable for a number of applications. It is nearly shatterproof and usually clear. In my somewhat younger days, I used to do a lot of private flying. Have a commercial pilot's license with an instrument rating. I remember the first time that I hit a turkey buzzard in a light aircraft down over the deserts of southern Arizona. There were feathers and I don't know what all in every which direction. But the windscreen on the aircraft did not crack, break, or deform. It took, essentially, the hit from a 4-pound bowling ball traveling at about 160 knots. And at that time, I learned something about the strength of polycarbonate plastic. Imagine having that strength in a filling. We understand a little of the history. It is very clear and easy to clean. That's why we continue to see it used. The global annual production is about 6 billion pounds. It's produced internationally by 15 major chem manufacturers, and it's hard enough to replace steel and clear enough to substitute for glass. Wouldn't you like to have your teeth sealed with something like that? I would think so. BisPhenol-A is also used in some, not all, but some baby and water bottles, sports equipment, medical and dental devices, eyeglasses, CDs, DVDs, and household electronics. Anything that cannot deform any wave path where a laser has to transmit a beam and hit a sensor very accurately will have some bisphenol-A used in the plastic that is used to make the device. It is still found in epoxy resin coatings used to line most food and beverage cans. If you took a steel or aluminum can and you filled it with tomato sauce, chances are excellent it would not last 6 months before it corroded right through the can. There has to be something in there to keep the acidity from reaching the metal, which in the can is frankly reduced, and I promise when that acid gets to it, it will oxidize and powder itself to nothing. From the standpoint of what is being used to replace it, the polyethylene terephthalate, or PET, and polyester, very closely related, are what we now see being used to line cans. How did we come to that? Is there danger in PET? Frankly, yes. But it's deemed not to be as serious as bisphenol-A. From the standpoint of using these in cans, there are regulations now in place with Health and Welfare Canada, with the European Union Health Agency, with the Japanese Health Agency. We see that this has also been looked at in Australia. We believe that there are some regulations pending in Brazil. And so most of the world is in fact going to terephthalate or PET for can linings. It is used in dental fillings and sealants. It is a fire retardant in certain forms, and it can be used as a fungicide. If you ever handle carbonless copy paper, the stuff you put in your credit card machine so you can print your original and a copy to give to the patient, carbonless copy paper relies heavily on bisphenol-A in its chemistry. thermal printing paper in any device that prints thermally is going to have the same issue. It is found in some water pipe linings, especially in PVC, but not all. If you have a home that is perhaps 10 to 15 years old, chances are excellent you have some plastic plumbing. It is likely polyvinyl chloride. In some formulations, the PVC has been augmented to strengthen and give it more durability. BisPhenol-A is found there. Now the mom that is just going berserk because you want to put a sealant on some child's teeth lives in a house that may well have that very kind of pipe. And I don't want to have to tell the mom, you know, you're straining at a gnat and swallowing camels here. You even run your hot water through that. But please understand that there are reasons that parents get so fearful. When we find plastic that is recyclable, sometimes when we see the 3 or the 7 in the triangle, this would suggest there is a possibility that bisphenol-A has been used to modify the plastic involved, to strengthen it, give it durability. Not all 3 and 7 plastics contain bisphenol-A. And we'll talk in a minute how you can get the bisphenol-A to leach out. Cycle codes 1, 2, 4, 5, and 6 are not likely to contain bisphenol-A. These particular recycle codes have plastics that do not lend themselves to the use of the bridging agent, the thing that holds acrylic together and perhaps some vinyl chlorides. We find that codes 3 and 7 may contain the bisphenol-A. There are differences between various products which feature the same recycle code. So don't go berserk in the aisle of your local grocery store until you're sure of which plastics are being used. Now, the troubling case. What are the claimed adverse effects? At what concentrations do they occur? At what age or stage of development are the effects initiated? Are the effects permanent or reversible? And I want to introduce a new question to the problem. Was the data obtained in animal or human study? Oh, this is a good one. We'll be right back to this. Animal or human BPA data, most scientific BPA data gathered is from rodents, mice, rats, hamsters, gerbils, things of this nature. I don't think there are many people who want to go and volunteer for this kind of service, unless you happen to be an orphan over in Spain and nobody speaks for you, everybody thinks you're expendable, and they decide to do a study on you. Having a human study is not simple and not without risk. Human BPA metabolism is vastly different from animal BPA metabolism. Is BPA introduced in the diet through eating and down the gastrointestinal tract or by injection? In the animal studies, sometimes they'll feed it to the animal, sometimes they will inject it. In the rodents, it doesn't really matter because it's going to do the same dirt. But in humans, it is radically important to know the difference. Is BPA found in the tissue and secretions or lavages as raw reactable bisphenol, or is it simply part of an intact microfine? We have had a number of studies where somebody says, I know that this particular composite was the worst one to leach BPA. Well, that's scary, isn't it, if you use it? and it is wholly irrelevant. Why? Having queried the people who did the study, and in fact I have asked questions several times of a researcher who did a study that the Academy paid for. Was this raw, reactable, bioavailable PPA, or was it simply part of a macromolecule? And not one of them can answer the question. In other words, no one bothered to determine. If it is still hooked into the long-chain polymer, it is not bioavailable, it does not cause the nastiness, and in humans, we're going to find out that it probably passes out in the next urine or bowel movement. The claimed effects. It's an endocrine disruptor. It mimics estrogen. Well, guess what? It mimics some other things too. And it's not the only thing we use that can do that, by the way. Early development period appears to be the most seriously impaired. It can target reproductive capacity, immune function, and nervous system and brain development. It can cause permanent DNA alterations to estrogen sensitivity and contribution to obesity. As a parent, does that make you a little concerned? It can potentiate dopaminergic systems, leading to supersensitivity to effects of drugs of abuse and hyperlocomotion. It impacts dopaminergic processes to induce hyperactivity and attention deficits. Anybody heard of ADD or ADHD? Corticosterone and its brain actions are altered by BPA programming effects. Anybody getting a little concerned about it yet? At least to have a little soft spot in your heart for mom when she comes in and says, I don't want you to put that stuff in my kid. BPA may bind to thyroid hormone receptors with potential interference, with greatest concern for pregnant women, neonates, and small children. May increase the risk for breast cancer, may decrease sensitivity to various chemotherapeutic cancer treatments. Now, there are papers that touch all of these. BPA exposure may disrupt prostate development and increase susceptibility to adult-onset prostate precancerous lesions, and hormonal carcinogenesis. May contribute to permanently enlarged prostate and may disrupt ovarian and testicular development. We have a plague today. Young males in our population have very small testicles. Many are non-functional. What will happen to the next generation? Anybody have a soft spot for mom and dad yet when they don't want to put the stuff in the kid's mouth? You ought to. Sadly, when the sensationalists in the news get this data, immediately we're out to save the world. It may alter hypothalamic estrogen-dependent mechanisms that govern female sexual behavior. It may mediate male behavior, sexual differentiation, and adult male sexual dysfunction and decline. It may disrupt blood-testis barrier in juveniles, reducing spermatogenesis. Where are the privileged tissue that the blood doesn't get to? Remember back in physiology? The cornea of the eye and testicular tissue. Some things can move across the barrier, but not blood. BPA seems to cause a breakdown in allowing that to happen. Low-dose BPA may lead to adverse pregnancy outcomes, including prematurity, preeclampsia, intrauterine growth restriction, and loss of pregnancy. And it may be associated with heart disease, recurrent miscarriage, oxidative stress, and inflammation. Human bisphenol chemistry. And by the way, we had to convert to PowerPoint. Usually these things come in one bullet at a time in my WordPerfect presentation software, but when you convert, it doesn't do that. So you get the whole slide. Orally acquired BPA is rapidly detoxified in the gastrointestinal tract of humans and then enzymatically in the liver to form BPA glucuronide, a water-soluble sugar substance with a half-life of 6 hours. In 6 hours, it should have been down in the bladder or have gone out in the intestinal refuse. Glucuronide conversion does not take place in rodents. BPA glucuronide has no endocrinicity and is easily excreted. Bisphenol-A glycidyl dimethacrylate, dimethacrylate, bis-GMA, associated with BPA clears the body in less than 24 hours maximum. What happens if it happens to get in the blood? If it happens to get through the intestine of someone with leaky bowel syndrome, leaky gut syndrome, or other impairments? Finding BPA moieties in the urine may be the best assurance yet that the body has been able to detox and neutralize any threat from BPA. I have seen several respectable papers from other standpoints. We found it in the urine. Praise the Lord. What can I say more? That is the neatest thing you can see, because if there has been anything that got away, so to speak, it is exiting the body in a capacity that humans have. Dietary estrogens, the phytoestrogens from nuts, seeds, soy, tofu, wheat, berries, bourbon, and beer, are also detoxified in a somewhat similar manner and voided in the urine. And so when we look at this question, we should ask, does this problem present any greater risk than having some cashews or some almonds as a snack? Now, the answer is maybe, and let's take a look at why that comes about in just a few minutes. Phytoestrogens and BPA are somewhat similar mimics and are referred to as estrogen disruptors if they gain entrance to the blood in meaningful concentrations of raw, reactable entity. Dietary estrogens have not been found to bioaccumulate and do not normally behave as disruptors. Once BPA glucuronide has formed, if it should gain entry into the bloodstream in humans, it is normally transported to the liver, where further detox activity will take place. It then re-enters the gastrointestinal tract, and the horse race is on again. And if it happens to get through a barrier somewhere, it's going to get whomped on by the liver and right down through the hepatic duct, back into the gastrointestinal tract. We naturally detox BPA as humans, but mice, rats, gerbils, and hamsters cannot. Wow. Raw, unreacted, bioavailable bisphenol-A can be acquired into both blood and tissue and can bioaccumulate in certain patients that have failed metabolism. If they have a problem in the things they absorb. And so patients who are the most vulnerable are those that are in poor health overall. We'll suggest some possible alternate materials for them. Blood and non-digestive tissue-acquired BPA is not known to readily form the glucuronide sugar form. In both blood and tissue, raw BPA easily binds to sites intended for estrogen. Harsh cleaning agents with very strong acid or alkali can break the bond that holds BPA to the long-chain polymer acrylic. If you are using very strong cleansing agents with appliances, you may be introducing something that has raw bisphenol-A. Heated, elevated temps, usually 400 Fahrenheit or higher, can break those bonds. I don't know of very many patients who customarily go and put their head in the oven for 20 minutes at 400 degrees to help cure the sealant for a little longer, or I don't know why they would do it. I don't know any that do that. Perhaps you do. The most serious exposure, and I'm sorry, strong ionizing irradiation can break the bonds. If you have the wrong kind of baby bottle and you warm it in the microwave, you will produce raw, bioavailable, reactable bisphenol-A. I don't know many patients that stick their head in the microwave and take it through a cycle to heat the head up. Maybe they think that would give them better thought processes or something. I don't know. Limited slow release over time can take place, but as long as it is swallowed, it forms the glucuronide form and is voided. The most serious exposure from raw reactive bioavailable material comes with faulty measuring and mixing. Today, auto mix cartridges have saved the bacon for a lot of us. But if it says mix 1 part A and 1 part B, that doesn't mean 9/10 part A and 1.1 part B. But sometimes when things get in a hurry and we manually mix, what do we end up with? One of those components is in excess. It may or may not allow proper polymerization in any of the mix that is there, and you end up with something that's going to stream bisphenol in an irregular way for a while to come, as in several days' worth. Care in mixing. This is a matter of care in your practice. Some practices do not use a rubber dam or similar protective measures when placing and working with BPA-containing substances. And in some cases, we're in a hurry. We just got to slap a little of this on those teeth right there. And we do not bother to do a thorough and complete cleansing when the work is finished. If there is an extra element of care and safety for your patient, it is in the care and the finesse of your practice of the profession. Do you take the time and the care to be exact and precise? You can control that. Patients should be cautioned to restrict intake of very hot beverages for several hours after the installation of a BPA-containing material, and carbonated beverages and those with acidic juices should otherwise be restricted for several hours after installation. Well, gosh, we do that anyway. We tell our patients this because the cure is still taking place, and we told them that. But now you have a new reason to tell them. General restrictions regarding heavy chewing and eating very hard foods. This is not the time for hardtack Christmas candy immediately after placement in the operatory. And if you do this, it will also help to preclude BPA release from a filling mass. In the immediate period after materials placement, there are obviously some unpolymerized constituents, in the center of the mass that you have placed. They may require a period of hours or perhaps a day to completely finish the curing process, but usually if we get at least 1 millimeter depth of cured material, raw bisphenol A and other constituents of concern do not migrate through the cured layer. Short of a catastrophic cleavage, we don't have to worry that in an hour some of the stuff down in the center of the mass is somehow going to come out and poison the patient. Cleanse the patient thoroughly. And in this particular concern, cleanliness is next to godliness. Can I say more? Once the first millimeter of surface material is cured, we've just mentioned this effect. Anything leaving the mass as a broken microfine will be swallowed as intact material and not as raw, reactable bisphenol or anything else. And the microfine physically, without even having to go through the glucuronide step, goes out in the next bowel movement. There is a great difference between intact material that is bound and raw, reactable reagent. Precautions with galvanic cells. You can, in fact, put some materials in place that have enough potential difference between themselves and other things already in the mouth or elsewhere in the body to create the cell effect. The cell will drive unintended material in the way of constituents out of the mass. And let me tell you, there is nothing worse about that than using certain zirconia-type sealants, bonding agents, composites, or crowns with a titanium implant and somewhere else in the body, like the knee or the hip or in a spinal fusion and stabilization, to find that the orthopedic surgeon has put in nickel chromium steel. Talk about an electrical zoo. You always want to ask your patient, do you have any orthopedic placements? Do you have a bone that's screwed together somewhere? Do you have a new hip? Do you have a new knee? Did you replace an ankle or a shoulder or an elbow? If so, we need to contact the orthopod to find out what is in that material. Yes. From the standpoint of where the conduit is formed, it is generally through the vascular bed. This was demonstrated beautifully back in the early 90s by Dr. Bjorn Nordenstrom at the Karolinska Institute. And Bjorn was able to show that whether it's something in the foot and something up in the neck, it matters not. It will use the blood vessels and the blood to complete the galvanic circuit. Any of you ever run across Bjorn's book, and it's still hard to find, but it's called Biological Closed Electrical Circuits. It's a big, thick book, and it isn't something to read when you're tired. But let me tell you, it's well worth having if you can find a copy. Some severely compromised patients may lack the normal human capacity to form the glucuronide, to manage liver detox. Porcelain, ceramics, and specialty products such as nylon or polyesters may be useful substitutes for these patients. They are not candidates for sealants. And these are some possible things you could substitute to keep from challenging them. These are also things you can use when mom and dad have the National Guard standing behind them with a howitzer pointed at you, and they say, wow. Acetyl resin, properly cleansed to remove any non-polymerizing formaldehyde, may also be a useful substitute for such patient. Carboxylate-based cements might have some limited usefulness for the chemically sensitive, and very young do not always have mature defense mechanisms in place for anything. You need to bear that in mind. How do I know if my materials have problematic content? I pulled off a couple of MSDS sheets from two very popular, familiar composites. I have done everything I can to obliterate which ones they are purposely. When you do not know which material to use, what do? There's a scat of folks that call us and say, do I have any BPA in this product? Let me show you how to do that quickly and efficiently in your own shop. Pull out your loose leaf binder that has the MSDS sheets that you're required by law to have on hand. Look at the content or ingredient list. An MSDS does not tell everything. This particular material has 18 antigen groups in it. So I'm just telling you, it doesn't tell you everything. But if there is bisphenol-A, it's going to show up here. Why? Because almost all of the Western governments have said it has to. Fair enough? Dimethacrylate is not bisphenol. This gadget is not bisphenol. None of these involve bisphenol. If you are avoiding bisphenols for a patient and this material otherwise meets the requirements of your placement, use it. And you can look mom and dad in the eye and say there's no bisphenol in this. On the other hand, do you see right here? Do you see right here? There it is revealed, right in the sheets that are in your file cabinet. And you will know exactly which materials to avoid. If solid raw BPA is inhaled, cough and sore throat may follow. Provide fresh air to breathe. Keep patient calm and quiet. And if necessary, move them to receive medical attention. If raw BPA comes in contact with the skin, remove any contaminated clothing and rinse the skin with plenty of water or shower. Use only gentle soap. We don't want any harsh chems mixed up in this. If redness ensues, seriously, seek medical help. If raw BPA gets in the eyes, the patient will experience severe redness and pain. Rinse the eyes several times with fresh, clean water. If possible, remove any contact lenses and arrange to move the patient for medical care. Ingestion of raw BPA may induce nausea and gastric pain. Rinse the mouth with fresh, clean water. Offer water to drink. If symptoms persist or intensify, medical care. Now, I'm going to pass this for the moment and come to this to close. What is the verdict on bisphenol-A? No, it is not completely safe. And please do not lie to your patients. It's my experience in watching things that the minute you lie to them about one little thing, they consider you a total liar about everything you do. Be honest. Yes, there is some bisphenol-A, and this is why I'm not worried about it. They may not accept your explanation. I don't care if there's glucuronide or not. If they don't want to accept it, they don't want to accept it. We've mentioned a few possible substitutions. requires knowledgeable use, demands skill and care to apply. It remains very useful with proper handling. The safety of the patient is in your hands, your technique, your care. You can minimize the effect dramatically. Risk is commensurate with other restorative components and products. I can tell you some things about acrylates that will raise the hair right off the back of your neck, but we still find them to be very useful. And so as a final verdict on this product, I believe that bisphenol A is useful. I have products in my own mouth that contain it, as does my wife, as do our 25 grandchildren. If I thought for a moment that we were poisoning them, I promise you faithfully it wouldn't have gotten the same room. I can suggest that with caring placement, with care from the doctor, with follow-through, and with some education to the patient, it's one of the best things that you can do. Thank you. Sorry? I believe that you can safely use anything that the manufacturer has recommended. They are all under the gun right now, and every one of them has a letter on their website. You can download and print it. If the manufacturer says you can use pink squeegee, you can safely use it and know that you are not going to cause an increased release of raw bisphenol A. Mm-hmm. And this is one time when the manufacturers are under the gun enough that I trust what they say. Thank you. Yes, I'm sorry. The disaster comes with mixed etiologies. And if you can't take it out of a spinal fusion, or it's going to be a disaster to move it from the acetabular ball that's in the hip, then you may have to find a steel and something commensurate to use with it, such as an alumina rather than a zirconia. And in the process, you may have to get rid of the titanium. A chrome cobalt steel, a moly steel. There are several variants that could be used in dental products. I'm not promising you that it will be easy, but they are available. And I've become very much appreciative of this as we build our database for both the orthopedic profession and the dental profession. We know the products are there that could be used.
I have one more question. You want to take one more?
The surface sealants for composites such as Fortify or BisCover, do those have EPA and do those help to seal off the surface?
Well, you understand, having more than 15,000 products in the database, if I don't remember what's in each one, if it is something for which you do not have an MSDS to look at, drop us a fax or an email at the office and I'll be happy to look.
Let's thank Jess for another great presentation. Thanks, Jess. Just a couple of